delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to Dr. Aisling Sheehan.
Good afternoon, everyone. Thank you so much for being with us today. We're delighted to be here. My name is Aisling Sheehan. I'm the National Lead for the HSE Health and Wellbeing Alcohol Programme. And today we're partnering with Mouth, Head and Neck Cancer Awareness Ireland. We're a voluntary body made up of dental and healthcare professionals, cancer survivors and advocacy organisations. And today is Mouth Cancer Awareness Day, and we want to use today as an opportunity to highlight alcohol as a cancer risk and to look at how we can reduce alcohol cancer risk through reducing alcohol use in the population and with our patients and service users. We really appreciate you using up your lunch hour to be with us today. We hope you find the event informative and useful. We encourage you to tweet using the hashtags #MouthCancerDay and #Alcohol and Cancer. I'm now just going to share my screen and share with you the lineup for today. We have a great range of speakers who are going to have huge expertise in their respective topics. And I'm going to start with introducing you to Dr. Triana McCarthy. And Dr. Triana McCarthy is a consultant in public health medicine, and she is Director of Public Health at the HSE's National Cancer Control Programme. Where she leads the cancer prevention function. And Triana is going to cover with us today the relationship between alcohol and cancer risk. So without further ado, I will hand you over to Triana. Thank you, Triana.
Thanks, Aisling, and good afternoon, everybody. As Aisling said, I work with the National Cancer Control Programme, and what I'd like to talk to you today is very much just about that, how exactly alcohol can increase people's risk of cancer. So in terms of the overview, of what I'll be presenting, it will be to look, as I said, as how it increases risk of cancer, what types of cancer does it cause, and then also a little look at how many cancers could be avoided by reducing alcohol intake in Ireland. So I don't want to really bypass the fact that there are quite a number of other harms from alcohol, obviously, in Ireland, and this HRB report, for anyone interested, does give a good overview. But I might just land very briefly on their graphic display here of alcohol consumption in Ireland, and you see a particularly worrying increase around the time of the Celtic Tiger, but also the fact, unfortunately, it's plateaued. Our alcohol intake hasn't really continued to decrease as much as we'd hoped. But in the story for alcohol and cancer, I'd just like to highlight that actually, it's the type of alcohol that people are drinking doesn't really matter. It's actually just the compound ethanol. That's what matters. It's actually how much pure alcohol people are taking. It doesn't really matter what type of alcohol, whether it's beer, spirits, or wine. It's your overall alcohol intake that matters in terms of cancer risk. And this is from the Healthy Ireland survey back in 2016, which really just emphasises how little people were aware of the link between alcohol and cancer. So we'll be repeating this hopefully in the next year or so, just to see how things change. But while people may associate alcohol with liver disease, for example, awareness of things such as the link with breast and bowel cancer and some of the other cancers I'll discuss today, just wouldn't be as well known. So to move on to how exactly does alcohol cause cancer? I mean, the first kind of when ethanol, which is the compound within alcohol, when that's broken down, primarily in your liver, it's this toxic metabolite called acetaldehyde. That's the one that really causes the health problems for us when it comes to cancer, and it's a particularly toxic metabolite. And if you see in this graph the way it's broken down further to acetate by another enzyme, one of the first things noticed was that people who were deficient in that enzyme, they had a marked increase in cancer, and that's because the levels of the metabolite acetaldehyde were building up in their system. And with esophageal cancer in particular, that was noted. So it's the breakdown of ethanol into acetaldehyde is what's what's causing the damage. And what it does is it interferes really with your body's ability to repair DNA. So obviously our cells are growing all the time. They're this turnover of the cells, we have mechanisms in place to correct the errors that happen, and acetaldehyde interferes with those mechanisms in quite a number of ways, including binding to proteins, getting tumors or proteins that would normally help, say, correct those errors are interfered with, methylation within, with your DNA, and that's a folase. It can be a folase antagonist. So that's exacerbated by people who have poor diets. So again, people who have high alcohol intake in particular, it's empty calories and it can replace other nutrients in your diet. So if people have a low folate intake as well, that's really exacerbated. And the other one I'll mention there is your immune system. When an actual tumor is growing within your body, your immune system works hard to act against that. And if your immune system is impaired by acetaldehyde, that's obviously going to increase your risk of cancer as well. It also, ethanol itself can work to increase the risk of other carcinogens or cancer causing agents that you take in. So either through the CP450 pathway, so it sort of accelerates the action of those other carcinogens, but then also unfortunately ethanol and alcohol is quite a good solvent. So it's a really good kind of an expert delivery mechanism in terms of delivering other toxins to your cells. So this is particularly important when you think of the upper aerodigestive pathway, so your mouth, your throat, and your gut, because it's basically taking things such as the toxins which are within cigarette smoke, for example, or other toxins you're exposed to, and it's helping them be absorbed into your cells. So that's another downside of ethanol in terms of increasing your risk. We know that alcohol can have an influence on your hormone levels, so increasing the amount of circulating estrogen. Obviously, if you're hormone sensitive tumors such as breast, that is an important role it plays, and other conditions such as the effect on your liver and causing cirrhosis of the liver, which again will predispose you to the development of cancer there, and gastroesophageal reflux disease, which is where you get reflux with too much intake of alcohol, and the acid damages the lower end of your gut. So again, damaging those cells and making them more prone to the development of cancer there. So that's a whistle-stop tour through a range of different mechanisms where alcohol influences both the initial development of cancer and also the ability of your body to combat it. So what I'd like to move on to in this section is to focus in on the types of cancer that it causes, some of which I will have just touched on there. And for quite a number of them, there's extremely strong evidence for the ones I'm going to list here, which are, I've already mentioned, the upper aerodigestive tract, so your mouth, your larynx, your pharynx, your esophagus, your stomach, so where the air and food comes into your body. There's extremely strong evidence there. Your liver and the intrahepatic bile ducts, your colorectum, so your large bowel, and then, as I mentioned earlier as well, breast cancer. And now there's very strong evidence for both premenopausal and postmenopausal breast cancer. And interestingly, there is evidence now as well in terms of a decrease in the risk of kidney cancer. There's limited evidence, so where it's kind of suggestive that there's an increase in the risk of, but it's difficult maybe to separate some of the confounding things. So that alcohol could increase your risk of lung cancer, of pancreatic cancer, and of two types of skin cancer, basal cell cancer and melanoma skin cancer. But the bottom line in terms of the kind of strength of the evidence is that IARC, which would be the sort of internationally recognized body in terms of deciding what truly increases your risk of cancer, they would class alcohol as a group 1 carcinogen. So that means that there is really sufficient evidence of the cancer causing properties of alcohol, and that there is, the association has been shown in humans as well. So it's the fact that they have looked at the strength of that and looked at things like chance and bias and confounding, where it's things being confused with a different factor, and been able to rule that out with confidence. And that would be the status of alcohol. And there, I'll just highlight 2 reports here, which are very good in terms of the World Cancer Research Fund has a continuous update project where it looks at particularly other alcohol, but other dietary factors as well, and their association with cancer, and also the World Cancer Report from IARC, which is part of the WHO, and they look at the emerging evidence and keep this updated. And the two additional facts, I suppose, that you will see in these reports is that it's generally for almost all cancers, it would be a linear dose response. So it means that, you know, it's just that the more you drink, the higher your risk. The less you drink, the lower your risk, would be an important takeaway point. And also that, you know, for cancer at least, and alcohol risk, it's that there's really no threshold below which there's no effect. So you know, that it is really from, you know, there, it isn't that, you know, below a certain number of grams per day that there's zero impact. It really is just an increase with the intake, and also that it's cumulative over your lifespan as well. So finally, I just would like to talk about how many cancers could be avoided, and this one is in terms of describing how do we estimate the number of cancers that are caused by alcohol consumption. And it's important to emphasize, I suppose, that when we do these studies, it's a kind of an epidemiological technique. So it's not that we look at tumor samples from people and can see, oh, this tumor was definitely caused by alcohol and this one wasn't. It's more that we look at the risk within populations, and that we take different pieces of evidence and put them together and see, you know, what difference it makes to our population, whether people drink or don't. And the pieces of information that go into this calculation would be, obviously you need to know the number of diagnoses in your country of that particular cancer type. You need to know the risk factor prevalence, so how much alcohol has been consumed by people in different age groups, etc. And then you need robust evidence in terms of, well, by how much does that risk factor increase the risk of that particular cancer type? So those studies I mentioned earlier from the World Cancer Research Fund or reports, and from IARC, they look, you know, in depth at the studies for different cancer types, and there'll be a different level of increase across different types. And then using those, you get a fraction which tells you for your what proportion of that particular cancer in your population could be attributed to alcohol use. And really what that means is, you know, when you take that proportion and how many cancers are in your population, it really tells you, if no one drank alcohol, how many cancers could have been, you know, would not have occurred at a population level. And again, to remember the linear dose response, really, you know, so if half as much alcohol had been consumed, then that would be half as many cancers. So the IARC, who I've mentioned already, have done this quite recently, again, in terms of in a worldwide study and updating this for different countries, taking the data that's available in terms of alcohol use, the incidence of cancers, and I'll share the reference there, but you can also look on the website if you want to see in different countries what the incidence or what the attributable fraction for alcohol associated cancers is. But in Ireland, this is just a brief summary of what percentage of cancers can be attributed to alcohol use, and this is just from 2020. And probably not surprised to see from what I said about the upper airway digestive tract and those mouth, pharynx, larynx and esophageal cancers, it's a much higher proportion of cancers. So you're talking about 20 to 30% in those cancers because of the direct effect, the solvent effect, delivering the toxins to the cells so efficiently, for want of a better word. But I'll also just emphasize that there are, two cancers there where it's a smaller proportion that you would say are attributable to alcohol intake when it comes to breast cancer and bowel cancer, but they are extremely common cancers. So for extremely common cancers like that, even when you're in the 5 to 10 to 15% increase of risk, they're such common cancers that it does actually mean quite a large number in the population. So it's a mixture of having the opportunity to greatly reduce your risk of certain cancers, but also even a small reduction in some very, very common cancers is important as well. And their estimate in terms of the overall number of individuals diagnosed with cancer per year that could have been avoided would be 1,000 cases per year. So definitely a very significant number. So just before I finish up, I'd just like to go over just a couple of the key messages. And one is that in terms of how certain we are that alcohol is linked to cancer, it is in the absolute top category. It's a group 1 carcinogen, and there's absolutely strong evidence that it causes cancer in humans. There's no sort of risk-free minimum alcohol intake, that any level of alcohol intake will increase risk of cancer. And as I said, it's a dose response relationship. So it's a linear dose response. So that the higher the alcohol amount consumed, the higher the risk. And then again, just to mention that the alcohols, the cancers that we know alcohol certainly increases the risk of are those of the mouth, larynx, pharynx, your esophagus, stomach, liver, bowel, and breast. So I'd like to thank you for your time, and I'll just leave you there with the website for the National Cancer Control Programme if you're looking for any further information on reducing risk of cancer or cancer services. And also I can be contacted at prevention@cancercontrol.ie. So thanks for your time.
Thanks so much, Trina, for a really fantastic overview of the link between alcohol and cancer. We'd like to share a couple of polls for you now, if that's okay. We'd love to hear from you on a couple of questions. And one is around your confidence in discussing alcohol as a risk factor for cancer. And secondly, how confident you feel in your knowledge of the signs and symptoms of mouth, head and neck cancer. And we'll share the results of the poll and discuss them later in the Q&A section. So thank you, Trina. I'd now like to introduce you to our next speakers. So Dr. Eleanor Sullivan and Dr. Denise McCarthy. We're going to do a bit of a deeper dive into mouth, head and neck cancer for this next presentation. And as Trina covered in her presentation, alcohol poses some of the greatest risks to those cancers. And also, given that it's Mouth Cancer Awareness Day, we thought it was really important to spotlight these cancers. And we know that not all of these cancers are preventable. So knowing the signs and symptoms, early detection is really important. So Dr. Eleanor Sullivan is a senior lecturer in oral surgery at the Cork University Dental School and Hospital. Denise is an associate professor and consultant in restorative dentistry at the Dublin Dental University Hospital. Both are founding members of Mouth, Head and Neck Cancer Awareness Ireland, and both have just a huge amount of experience and expertise in both the detection and the treatment of these cancers. So we're really, really pleased to have them speak on this topic. And they're going to do a joint presentation, and I'm going to hand you over to Eleanor first. Thank you, Eleanor.
Excellent. Thank you so much, Aisling. And it was excellent to hear all the information provided as well by Trina. I suppose myself and Denise are extremely pleased to be able to take part in this, because today is Mouth Cancer Day, and it's a great opportunity to be able to flag the importance of this and to raise awareness. As we have an actual mixed audience, what I want to do is actually just start by stating what actually mouth, head and neck cancer is. So mouth is a subset of oral and pharyngeal cancer, and that in itself is a subset then of head and neck cancer. So as you can see, it actually covers over 17 separate subsites. And if you look at those there and just think today what you have done in relation to how you've used your own lips, your mouth, you've been able to eat, you've been able to speak, you've been able to taste your food, you've been able to swallow it with ease. So all these things are actually hugely important for us to have a normal and enjoyable life. So even though head and neck cancer is considered to be one of these extremely rare cancers, it's actually the 6th most common cancer overall worldwide. And it has, I suppose, been spoken about in relation to lots of famous people, but sticking with Irish people, I think all of you would actually recognise Ronnie Drew, and also this gentleman, Alex Higgins, both of whom were superstars. Ronnie Drew and his family actually were very helpful to us in relation to the Mouth Cancer Day for 2012. And this is a photograph of Alex Higgins, which I think is extremely powerful. This was taken just a couple of weeks before he passed away from head and neck cancer. And this was thanks to the photographer, actually Cathal McNaughton, who lets me use this photograph. And I think it says it says more than I can really say about head and neck cancer in relation to the overall impact that it has on an actual person, how it strikes at everything that's important to us. So again, I suppose just to give an overview of some of the basic facts, it's the 6th most common cancer worldwide. So, and we have to bear in mind that only 1/5 of cancer cases are actually recorded, because cancer registration is only in areas that are well developed. So at the moment we have 2/3 of a million people get this disease, and over 1/3 of a million people die actually each year from head and neck cancer. So for Ireland, it represents roughly 3% of cases, and roughly 770 people get this disease. So that, it mightn't seem like a huge number, but actually 4 people die every week in Ireland in relation to head and neck cancer. So, and we've over 3,000 people that are walking around, that are seeing all of us, that are going to GP practices, dental practices, etc. And all those people need our assistance. So it used to be much more common among males. It used to be 6 times more common roughly 50 years ago, but that now is down to just over being actually twice as common in men as it is in women. And that is still changing. Specific sites, for example, larynx is still dominated by men, and the average age of the patient is roughly 63, but again, that is actually showing signs of decreasing, and we're now starting to see a lot more patients actually presenting with head and neck cancer, particularly in relation to tonsil and also mouth cancer at ages anything from 35, 40 upwards. We have seen decreases at certain sites, particularly salivary glands and lip cancer, but we are seeing an annual increase every year, particularly for the intraoral cases, and that's going up actually by 3% each year. And for tonsil, it's rising by 4%. And I suppose out of the 700 cases that are actually diagnosed each year, I've added the numbers here on this infographic because over 400 of those are in areas that you can see very readily. For example, in the oral part of the tongue, your salivary glands, in the soft palate complex and the lips. So all these are areas that all of us healthcare professionals are able to easily examine, and patients can self-examine. And my colleague in a minute is going to go over this examination actually with you. So in relation to etiology, as has already been stated, roughly 1/3 of all these tumours within the oral cavity and also within the pharynx are specifically attributable to one substance, and that is alcohol. And when you combine tobacco and alcohol together, it is estimated that it actually causes roughly 90% of all head and necks and also cancer of the esophagus. So looking at alcohol alone, as I say, it actually is associated with roughly 750,000 cases of cancer, and 60% of those are in the upper airways and the upper digestive tract. And as has already been stated, roughly 1/5 of laryngeal cancers and 1/3 of oral and pharyngeal cancers are specifically linked to alcohol. So in relation to the intake of alcohol, there is no safe level. I'm not saying that everybody has to become a teetotaler, but it is important for patients to know that it's a simple message, as has already been stated, that if you consume alcohol, it's a case of the actual risk increases with the intake. And for people who are heavy drinkers, you actually have an increased risk of over 5 times. And I suppose it's one thing as well that we have a small bit of a blind spot in Ireland in relation to, there was an interesting study that was done, and it showed that 50% of Irish drinkers are actually extremely hazardous drinkers. And in men that were aged under 34, it was 78%. But when they asked them if they thought they were heavy drinkers, only less than 3% considered themselves to be heavy drinkers. So it can be something that is extremely important to actually, I suppose, ask our patients about their intake. It is our right. It is important that all of us ask. We've got really good at asking about smoking. I think that we need to perhaps get a bit braver about asking about alcohol intake, because the patients have a right to know that they are overdoing it and that it's putting their health at risk. So I won't go over this because it was covered really, really well in the last presentation. But again, in relation to the oral cavity, again, if you look back at the slide where I showed where we had the largest number, which is in the oral tongue, especially at the lateral borders and the undersurface, and also in areas in the floor of the mouth and the soft palate complex, all these actually have a very thin mucosa. So it's an area where if you consume alcohol and also tobacco or either one, all these carcinogens can easily go through the soft tissues there and enter into the cells. So I suppose the signs and symptoms that we all need to look out for would be ulcers that don't heal. This is a very large one, but even small ones that don't go away within 3 weeks need to be explored and biopsied. So areas that are red or speckled and white, areas that are red, extremely strongly red and velvety, which is erythroplakia, areas of abnormal pigmentation, like this is a melanoma in the palate, and the 5-year survival for this is actually 0. Anybody presenting with an abnormal neck mass, this is one of my patients, and I find scarves and beards can hide a multitude. This is a lady I saw in a couple of years ago and was extremely keen on her little silk scarves. Under that scarf, she had a lump which was the size of roughly her fist, and unfortunately she didn't survive very long. I have another patient currently who had a huge bushy beard, a bit like Ronnie Drew, and he had a mass under that which was hiding nicely. So alteration to speech, particularly hoarseness, difficulty swallowing, is often a very important warning sign in relation to oropharyngeal and also hyperpharyngeal cancers. If somebody has a sore throat, a normal sore throat will normally be bilateral, so if it's unilateral or if they have ear pain on one side, or issues in relation to opening their mouth difficulty, which is trismus, or unexplained alteration inside the mouth, dentures that don't fit, sections of teeth becoming loose. All these are extremely important warning signs that I think we can flag. We can put leaflets in our waiting rooms, etc., and just instruct people to look out for these. I suppose the reason that this is important is because even though it isn't one of the most common cancers, as I said, we've over 700 cases, but it has one of the worst survival rates of any of the cancers, much worse than cervix, breast, or even melanoma, which again is known to be a killer. Overall, the overall rate of survival for 5 years has stayed very stubbornly at roughly 50%. We have seen improvements in relation to tonsil, etc., because of the HPV link. But it is better at some sites. For example, lip normally has a good outcome, but again, for the intraoral and for the oropharyngeal and for the ones down that are further down the throat, the outcomes are very poor. This is because only 1 in 5 of our patients presents in stage 1, as you can see over there on the diagram, and roughly 2/3 of our patients present at an advanced stage, which is stage 3 and stage 4. Roughly 1/3 present when they're ready. It has spread into the neck and presents with a neck lump. So these are just a couple of snapshots of some of my patients, and this is a person who had SCC, squamous cell carcinoma, which is the most common sort of cancer that we see in the head and neck, and it presented with a lesion there on the gum. And after resection and after replacement of the area with a special denture, they had a very good outcome, extremely good form and function. This is a lady who I've known for a long time and who has been one of our advocates. And she has a really active and extremely full life, and she works and everything else. But this is her resection that she copes with every single day. She presented, she thought it was a toothache initially. It was something which she, I suppose, ignored. She wasn't a fan of the dentist, like lots of us, and opted to let it go for a while. And she came to the dental hospital, and at that stage it was a stage 4 tumor. So she's had a huge resection, as you can see here. Over half the jaw is gone, and it has had a huge impact on her speech, on her ability to eat. But she is doing well otherwise. This is another one of my patients. He presented with what he thought and his family thought was an abscess. You can see his teeth are floating inside this mass here. And this was an absolutely huge tumor. He was age 40. He was an alcoholic, and this was his resection. So I think I don't need to ask you to use much imagination when you think of the impact this has had on his quality of life. So I suppose the message that I want to give is that all of us need to be extremely conscious and extremely aware of the risk factors, and also look out for the signs and symptoms and to educate our patients. So I'm very pleased to introduce my colleague Denise, who is going to expand on this. Thank you.
Thank you very much, Eleanor. Mouth, Head and Neck Cancer Awareness Ireland was founded in 2009 to increase public awareness, improve early detection, and encourage self-examination and regular examination of this cancer. This voluntary organisation, which now includes the Dental Health Foundation, the National Cancer Control Programme, the Irish Cancer Society, the Cork University Dental School and Hospital, spun out the Irish Dental Association, the Dublin Dental University Hospital, and most importantly, the group of head and neck cancer survivors. The broad reach of our members has been very, very important in creating contacts and delivering our message out to the community over the last 10 or 12 years. The first Mouth Cancer Awareness Day was held in 2010, and a free mouth checkup was offered in the Cork and Dublin dental hospitals and in general dental practices all around the country. Thousands of people attended on this day, and we asked the attendees to complete a survey regarding what they thought might cause mouth cancer. 76% of the attendees cited smoking. However, only 11% of people cited alcohol. These results established that there was a very serious lack of awareness about this cancer, and as the accepted main factors in relation to the development of the cancer are smoking, alcohol, and if you smoke and drink, you could increase your risk substantially, the human papillomavirus, and sunlight affecting the lips. However, it's very important to say at this stage that not all people who develop mouth, head and neck cancer are smokers and drinkers. So it's very, very important to be aware and watchful at all times. So our group now, the Mouth, Head and Neck Cancer Awareness Ireland group, now provides information to people with mouth, head and neck cancer. As Eleanor outlined, this includes 17 subsites in this small area of the body, the head and neck area, the front part of the face. And the sites stretch from the nose and above the nose right the way down past the mouth and on down into the larynx, or the airway and the voice box. So the area of the body is small, but it's a very, very intricate number of different sites which are present in the area, and each and every one of those sites can be affected by mouth cancer, by the cancer affecting the mouth cancer affecting the area. So it makes difficult examination, and symptoms are often the early warning signs of the disease when there's a problem there. So what are the symptoms of mouth, head and neck cancer? Eleanor has already outlined the symptoms, and they include a sore in your mouth or an ulcer that doesn't heal, red and white patches inside the mouth, a lump in the mouth or neck. And you can read the rest of the symptoms of mouth cancer here, and going through the ones that are important in relation to a sore throat and hoarseness of the voice, or persistent nosebleeds, or a stuffy nose. It isn't unusual to have an ulcer in your mouth, for example, an aphthous ulcer, which heals within 10 days. Or indeed, it isn't unusual to have a sore throat, as Eleanor has mentioned. However, if you notice any of these changes for more than three weeks, this is of concern, and it's very, very important to get in touch with your dentist or your doctor as soon as possible, within 10 days of 3 weeks being up. So mouth, head and neck cancer, the most common cancer affecting the oral cavity and the head and neck region is a cancer called a squamous cell carcinoma. And this is a cancer which affects the epithelium, or the skin, the lining tissue in the mouth and the head and neck area. So in this very basic diagram, the blue band represents the epithelium, and the yellow band represents the underlying connective tissue, or the deeper tissue underneath the epithelium. The red areas represent the development of cancer, which is described as being a crab-like invasion into the tissues. And cancer is described in a simple way between stages 1 and stages 4. And stage 1 is a small cancer which has just broken through the epithelium and has started to invade the underlying connective tissue. Stage 2 is a larger cancer and has a little bit more spread into the connective tissue. Stage 3 is a larger cancer again and is spreading and beginning to invade and involve other areas and other adjacent tissues. And stage 4 is the most advanced stage of cancer, when the cancer begins to break off, bits of the cancer begin to break off locally and travel to the local lymph nodes and metastasize to distant areas around the body. So the stage of the cancer will be diagnosed by means of a biopsy or a scan, and will be done in hospital once the cancer has been detected. So it's very, very important to detect the cancers at stages 1 or stages 2, because this is an early stage to detect the cancer. Once it's become established at stage 3 or more so at stage 4, it becomes more difficult to treat, and early detection obviously improves treatment outcome, the long-term quality of life and survival, as demonstrated very clearly by Eleanor in her slides of the patients that she's been treating. Obviously, primary prevention is very, very important in management of these cancers, and primary prevention really would come before the stage of the development of stage 1 of the cancer. But the very important thing is early detection and early recognition of the earliest stage of cancer. And that's very, very important for patient management and long-term treatment. So the dentist or the dental hygienist are very experienced clinicians in the examination of the mouth. And community healthcare professionals are important to encourage people to go to the dentist if they have noticed symptoms. And Eleanor obviously has mentioned already that there are more than 700 cases of mouth, head and neck cancer in Ireland annually. So all of us who work with patients, either in dental practice, in medical practice, in a pharmacy, in any aspect of healthcare, somebody might say, oh, I've had a lump in my neck, or I've had a long-term sore throat. And really it's people in the community and community healthcare professionals who encourage their patients to go ahead and get things checked out, which is very, very important. A recent audit of the patients who attended the clinic that Eleanor ran in Cork and I ran in Dublin until I recently retired, found that 76% of our mouth, head and neck cancer patients over the last 10 years attended the general medical practitioner as their first source of advice in relation to any concern with regards to their mouth or their throat. This is concern at some level because there's another study which found that recent medical graduates felt that they hadn't had a great deal of experience in examination of the oral cavity particularly. It's also of concern that up to 60% of Irish adults rarely or never attend the dentist. And this is in spite of the fact that many people are entitled to a free dental checkup every year on an annual basis. It may not cover treatment, but certainly a checkup is available and is very, very well worthwhile attending for this checkup. It's also very important to know that up to 90% of older people 65 years and older who are edentulous, in other words, they have no teeth remaining, no natural teeth, they don't attend the dentist at all, which is a big problem because it's in this age group that there's the highest risk. Between 55 to 75 is the highest risk for the development of mouth, head and neck cancer. The study carried out by myself and Eleanor, found that there was an increase in the number of individuals who were diagnosed by dentists and referred on for treatment at an earlier stage. So that was good news and was a good outcome for our study, for our awareness campaign. So what can we do to help with early detection? It's very important, as I've said, to attend the dentist at least once a year. Use that annual visit and attend the dentist for a routine checkup and early detection, that they'll recognize if there are any changes in the oral cavity. It's an important thing to get to know our own mouth and to examine our own oral tissues, to examine around our mouth and to be aware of what's normal and what's abnormal. You need a good light source with a mirror and examine your mouth, look and feel for change, palpate inside your mouth, feel the cheek and examine carefully. So at stage 1, or step 1, we examine the lips inside the upper lips and the lower lips and palpate the lips as well for any hardness that may have developed recently. And then examine the cheeks inside the mouth on the right-hand side and the left-hand side. Check to see if there's anything that looks unusual or that has changed. Then examine the palate, the hard palate and the soft palate. This is very difficult to do. And back to the area where the tonsils are situated. See if there are any changes, any redness, any enlargement on one side or the other. And it is a very, very difficult area to examine. It's hard, but you'd be surprised the number of people who do come in and say that they've noticed a change and are concerned. Step 4 will be to examine your tongue, and that's examining the back of your tongue, the top of your tongue, and the sides of your tongue. It's a slippery organ, so it's useful to catch it with a little bit of tissue paper or a bit of gauze. So examine the sides and palpate again and feel for any change. Examine the undersurface of your tongue and then down into the floor of your mouth, which Eleanor describes as being the area where there is a big risk with the buildup and the pooling of alcohol and carcinogens in that area. And then finally, look at your lips, check your lips, and very, very importantly, examine your neck to see if there have been any changes or any lumps developing in your neck recently. And people often find that they notice that perhaps if they're in the shower and they'll notice changes in their neck, which have occurred recently. So on Mouth Cancer Awareness Day 2021, we're reaching out to the community in Ireland and we're asking people to take control of their own bodies, to have a healthy lifestyle, do not smoke and avoid alcohol. Know the levels of alcohol that you drink if you do drink, and be aware of the risk. It is your right to know what the risk is. Eat a healthy diet, get the human papilloma virus, get the HPV vaccination, take regular exercise and use sunblock on your lips. Visit your dentist for a checkup of your mouth every year, even if you don't have any remaining teeth. Even if you've got complete dentures, go to your dentist and get them to check your mouth. Get to know your own mouth and check your mouth regularly for any changes with the 6 simple steps. And you can find a video with this intraoral examination explaining it in more detail on our website, mouthcancer.ie. And if you notice any changes which last for longer than 3 weeks, please get advice from your dentist or doctor within 10 days. And this could be one checkup that could save your life. So thank you very much.
Thank you so much, Denise and Eleanor. Such a really great deeper dive into mouth, head and neck cancer. And I think we can all see the importance, important role that dentists play, but also other healthcare professionals. And you've given some really practical advice there to build public and professional awareness. So thank you for that. Now for something a little bit different for our last speaker. We're really pleased to be joined by Una McKinney, who's from Alcohol Action Ireland, and they're the National Independent Advocate for Reducing Alcohol Harm. And he's going to speak to us today about alcohol labelling, which is due to be enacted under the Public Health Alcohol Act, and citizens' right to know about the link between alcohol and cancer. So thank you, Una.
Good afternoon, everybody. Thanks, Aisling, for the introduction, and thanks very much to all our partners who are working on this particular day. It's been great to have so many interested people involved in this particular issue and to highlight the the attributable link between alcohol and cancers. My role today essentially is to talk a little bit differently to what are the specifics of the illnesses and the instance of cancer, and to talk to you about the need for accurate labeling to be and on notice, the accurate labeling of alcohol products, which would identify the risk to people's health from the use of alcohol. And to kind of crystallize that for people, the basic principle of the right to know, the basic right of information has been largely central to a lot of the global public health initiatives, and in particular, I think of tobacco, and we've seen over a generation a significant shift in relation to how we understand and what we know about the risk around tobacco. And indeed, that whole idea of principle, you could argue the principle of information and the right to know, has been central to a really outstanding national effort to try and tackle COVID in terms of vaccinations and such matters. So, and to take up Trina's point earlier, awareness is critical here. People just simply do not understand. So what I'm going to talk to you a little bit about today is really just to look at, do a quick overview of what is in the legislation as we see it today. This legislation, the Public Health Act, which, as Aisling outlined, does make provisions for such matters, and to explore a little bit of the background around it. Well, why would we be pursuing this endeavor of information for people at a human rights level or at a consumer rights level? Because I think sometimes we don't necessarily always make those two connections, and I think it's kind of fundamental to what we're trying to achieve here. And also then maybe just to look a little bit about how that has played out in the background in relation to our sort of wider commitment in relation to some things like the EU project, and also to look very briefly at what has occurred so far internationally in relation to granting or giving these rights to people, and how it might look in various other jurisdictions. So to do a very quick overview of what's in the Act, and to remind people, the Public Health Alcohol Act essentially was passed after nearly a decade of advocacy, not just by Alcohol Action Ireland, but by a whole variety of players, including none other than the CMO, Dr. Tony Houlihan, who was at the centre of a lot of the work in relation to that. But it did take a decade to get there. And what we have seen so far since its enactment in 2018, which is about 3 years ago, we have we would regard about a half of the measures, or a little over half the measures that are contained in the Act actually implemented. And reminding people that the whole endeavor of this legislation is a public health. It's the first time ever that alcohol use and the harm of alcohol use has been viewed through a public health lens. And so what it endeavors to do is bring about a 20% reduction in alcohol use across the whole of the population over a period of 7 years. So central to that legislation is a commitment to the WHO best buys around alcohol reduction. So issues like price, availability and promotion. And some of you will be familiar with the most recent announcement in relation to the introduction of minimum unit pricing in 2022, which again will make a significant significant action in about reducing alcohol demand, because price is such an important part of that. And I think that overall in the 10 years that this has been advocated for, it is worth reminding ourselves and to make a positive contribution that we are beginning to see some green shoots in relation to a reduction in alcohol, and hopefully we can see that when the rest of the Act is implemented, that we know that these proven measures, as the WHO has outlined, will make some real significance. But to the measures that are in the Act around the labelling of alcohol products and notices, and in specific terms on the content of all advertising, these two particular measures, section 12 and 13, have yet to be commenced by government. And we would be arguing that this is central to the idea of people having a right to information and the right to make an informed decision. And so this would mean that in the future, all products would have, and all advertisements would state that there's a direct link between alcohol and fatal cancers, as we're talking about today. So that's a really important and powerful message to be heading towards. And we will be continuing our advocacy to try and get that section of the Act commenced as quickly as possible. So why do we think that citizens have a right to know about these matters? Well, again, without going into too much details, I mean, some of these basic principles of what are called democratic citizenship are inherent in universal declarations of human rights. They are inherent in many of the basic themes that we know that kind of survive and sustain our democracies. And obviously in any democracy such as like Ireland, we always try to balance those rights and the responsibilities for the citizens. But as COVID has demonstrated probably very well in this way, we do have a sort of demand by the state that people do take personal responsibilities for their health. And we would be arguing that, in the context of any responsibility that's been demanded of people, that they equally have a right to the information. And so as Trina and Denise and Eleanor have outlined, we're going to continue to see significant levels of alcohol-related cancers on the basis of the level of alcohol use in our country. But if we don't inform people of the risk, clearly identify for them what the risk is, then we can't expect people to necessarily embrace that level of personal responsibility that's demanded of them. So just very historically, looking back at this, I mean, for the last 70 years, some of these basic principles were outlined. Kennedy, back in the 1960s, adopted some of the principles of the Universal Human Rights Declaration to talk about the need for consumers and citizens to have the right to safety, the right to be informed, etc. And these measures subsequently were adopted by the EU and become real pillar aspects of what is EU direction around ensuring that there are safeguards for consumers around a whole variety of purchases, but also the fundamental point about food safety and what that would look like. And so what you see in this particular area is the language. This is direct language from the EU in relation to its consumer policy. It's about helping people make informed choices. And in terms of the food safety, it's about ensuring the highest level of protection for people's health. Now, these two particular statements that are embedded in these don't particularly tally with the lack of information that's been provided on alcohol products, which is exceptionally poor. Like, as it stands, we only have the volume and the ABV stated on alcohol products and nothing else. And some of you may very well be familiar with a variety of information that's on the back of some products, but that's all there on a voluntary basis. It's not dictated by statute. So since the 1980s and into the 1990s, the EU has been moving towards really trying to stamp out with directive and regulation a whole set of unfair kind of business practices around the provision of information. And indeed, in the 2005 directive, go as far as really speaking to the point of misleading people, so that, highlighting that if information is omitted from a particular consumer choice, that is in itself misleading the consumer. And so these are important principles and concepts. But regrettably, since 2011, at an EU level, which across 27 member countries, the provisions around food information have been the alcohol products have been exempt from those particular provisions. And that's because the alcohol industry largely lobbied the EU over an extensive period of 5 years before to 2011 to ensure that there was no mandatory commitment placed on the alcohol producers. Now, thankfully, again, since 2017, the EU has now moved to a position where they've recognized that position is no longer tenable. But nevertheless, the legislation still prevails. So Ireland adopting the measures that are within the Public Health Alcohol Act around labelling is quite an innovative and bold step. But as I say, it hasn't been commenced. And so those measures that we talked about As I say, they are outlined in global policy, certainly within the WHO's approach to reducing harmful use of alcohol since 2010, when they said that alcohol products should have health warning labels placed on them. And as again, in the context of Ireland, that was embedded in our National Substance Misuse Strategy in 2012. So just very briefly looking at the international context of this. So there's a couple of examples of where things have actually moved on in this. There was a pilot study in the Yukon in Canada, which introduced the labels, as you can see there on the right-hand side, which essentially declared the risk between alcohol and cancer. And the results from that were quite interesting, in so much that it demonstrated that 7% of consumer or purchases of alcohol could be reduced by placing such profound and clear, conspicuous warnings on alcohol products. That particular study was blocked by the alcohol industry, and a court decision was taken in relation to stopping it. More recently, in Australia and New Zealand, we have seen after a 20-year battle, a new type of labeling now going to appear in relation to alcohol products. And this is a really significant change, because this will be a legal requirement from 2023 in Australia and New Zealand. And I'm sure many of you will be aware that, you know, in Ireland, we certainly consume quite a bit of Australian and New Zealand wine products. So it'll be very interesting to see, does this gravitate into our particular landscape? And finally, in this context, you know, the Global Drug Survey, which was conducted in 2018, did indicate that if there was cancer warnings placed on products, we could see a 40% reduction, or 40% of drinkers would think about drinking less. So that's the impact that we have if people are given clear and unambiguous warning in relation to that. And then finally, just to kind of give in a positive sense, you know, the EU, as I say, were a bit delayed in coming to this party, but as of this year now, they have launched a cancer plan for Europe, which is a really far-reaching program. And what it's endeavoring to do is to ensure that there will be a mandatory indication of ingredients and nutrient values in all alcohol beverages, and that health warnings will be placed on all products before the end of 2023. So that's hopefully a positive note to finish on, but it's very much a whistle-stop tour of why we believe citizens have a right to know, and if we're really to address the lack of awareness, this type of information is central to that public health endeavour. So thank you very much for your time.
Thank you so much, Unan. As you say, positive developments, and I think really supportive of the work that healthcare professionals and other services working in this area can do in terms of reducing risk. We've just a couple of minutes, but I'd like to just do some really rapid fire questions to our panel, if that's okay, just with really brief responses. I know there's been some Q&A discussion throughout. And I suppose before I do that, I suppose just to sum up some of the key messages that I think we've covered today. Our first one is that alcohol can cause cancer. Secondly, we know we can reduce the risk. If we reduce alcohol consumption, citizens have a right to know about the risk, and also, if in doubt, get checked out. So there's been some really interesting questions come up. Very quickly, Trina, I think we can see that it can be a challenge to communicate the risk that alcohol poses and the low awareness in the public. And there's been a question around effective methods for communicating with the public. Anything very briefly you'd like to say around how we can best communicate with the public on this?
Yeah, I mean, I think Unan maybe has covered some of those issues around, you know, labeling and clarity of the message. And then I also think that it's you know, it's important that kind of the trusted professionals within the community as well are you know, well briefed in the area. So, you know, we've talked earlier in terms of, you know, people trusting their GPs, for example, or their public health nurses or their pharmacists. So I think it's important that people in that setting are also kind of willing to you know, to reinforce that message and to be comfortable in sharing it.
Thank you, Trina. Denise and Eleanor, do you have any tips or advice you'd like to share with others around talking about this topic with your patients? Eleanor, would you like to go first?
Okay. I work mainly with head and neck cancer patients, and roughly 87% of them drink, and about 40% of them would drink to excess, stroke, alcoholism. So it's something that I always just ask them about straight up. I never meet any resistance, I have to say. I think that if you tackle it the same as you ask about smoking, I think that all of us healthcare professionals now are very confident in asking about smoking, whereas it used to be something that people were very anxious about, and people used to actually be concerned that they would insult a patient and maybe lose a patient if they spoke to them about it. I think we just have to get a bit braver and just ask it the same as we ask any other question. And I think people actually usually respond quite well. I think, I suppose the first thing I'd like to say is that the HSE have a Making Every Contact Count program, which I'm involved in, and it actually goes through all this extremely well, and it's on the HSE website, completely free training. It's actually one of the key pillars is actually looking at alcohol. It's like everything, I think experience teaches clinicians how to interact with people, and I suppose you have to know when is the right time to push and when is the right time to pull back. You just give the information. All we can do is educate, aim to actually, I suppose, educate, and our aim is to empower the patient. Only he or she can make the choice to change. So I suppose that, yeah, I could talk about that for another half an hour, but I won't.
Thank you, Eleanor. That's perfect. Anything just very briefly, Denise, you'd like to add?
Just a very quick point. It is a very, very important thing to ask the questions. And having spent many years in education in the dental hospital, it was taken very seriously there. And in fact, what we did with students was we got actors to come in and did role play so that the students would ask, and they were videoed to see how they dealt with the questions and responded. So that I think the early training as well is very, very important, and of the healthcare professional is very important, so that they've got the confidence to ask people what maybe can be considered quite personal questions. So
thank you, Denise. We're joined as well by Kevin O'Hagan, who's the chair of Mouth, Head, Neck Cancer Awareness Ireland from the Irish Cancer Society. Kevin, is there anything else you'd like to share about the work of Mouth, Head, Neck Cancer Awareness Ireland, your next steps? And I know there's been some interest in the chat function there about maybe if people want to get involved and how they can do that.
Thanks, Aisling. Yeah, look, the Mouth, Head, Neck Cancer Awareness Ireland, we've been in existence now for over 11 or 12 years, and of course Eleanor and Denise have been founding members. But the group has grown from strength to strength, and I must compliment the entire dental community who've taken on this particular issue. And of course, mouth checks are now standard practice in dental treatment. And of course, we would love to see more healthcare professionals getting involved and really being, having those conversations. Clearly, the alarming statistic that, that 2/3 of mouth cancer diagnosed at a late stage, that's really worrying. Of course, the pandemic has really probably added to that, and that's a worry. So we need all of our healthcare professionals to continue to be aware of this issue, to be aware of those early signs, and to have the conversations. There's so much more work to be done, but I think a day like today and a webinar like this can really contribute to that. And of course, we have important public health measures in the Public Health Alcohol Act that Ewan has mentioned. If people are aware and know the dangers alcohol poses, then it can go a long way. But look, that's it. And anyone wants further information, mouthcancer.ie will give you more information about the group. But thanks, Aisling.
Brilliant, thanks. And just on the Public Health Alcohol Act, Unan, and public health measures, there was an interesting comment from the audience around non-alcoholic beverages that are being produced by the alcohol industry. Is there anything we need to be concerned about in terms of the alcohol industry producing these types of products?
Well, I suppose we should be generous in the first instance to say that anybody who can gravitate from an alcohol product to a non-alcohol product, of course, is a positive. But, there is a bit of a misconception out there that this is somehow taking over the world. At the moment, it makes up less than 1% of all beer drinking in Ireland. So it's quite a small number. Yet the alcohol producers are using these products as alibi products for marketing promotion, which is banned under the Public Health Alcohol Act. So there is a problem. that's sort of been going with the promotion of non-alcoholic beers in particular. But I think we should welcome the idea that the non-alcoholic beers have a role to play in trying to help reduce. You know, we're looking to try and bring about a 40% reduction in alcohol use in Ireland if we want to have a society drinking at a low risk engagement on alcohol. And so, you know, that has to be part of that mix potentially.
Great. Thank you so much to everyone. I know we've run a little bit over time, but I just want to say a huge thank you to all the panelist speakers. Thank you to everybody who's still with us. I know we still have a large portion of the audience still with us, so really appreciate you taking up your lunchtime to be with us today. We will have a recording of the event being circulated afterwards. We'd really encourage you to share that with your colleagues and anyone you think is interested, and also a range of websites and resources where you can find more information. Just a couple of people who worked a lot behind the scenes for today that I'd like to specifically thank. And that's Anya Ling and Noreen Turley, who've done a huge amount along with other colleagues of ours in preparing for today. Thank you to everybody. We also have an infographic that we've been produced today that we'll share with you, and we'd love it if you could help promote that as well. So thank you, everybody.